Hello, this is Dr. Shemin. Today we're going to discuss your parathyroid surgery, before, during, and after. Now, we've discussed in the office, and you certainly are welcome to visit our video channel to learn about parathyroid disease and the surgery. But what we're talking about is that this is the thyroid, which is situated over the voice box. You can see it well over here in this model. This is where the thyroid sits. The parathyroid are usually 4 glands that sit on the back side of the thyroid. This is approximately the normal size. This is an enlarged parathyroid called a parathyroid adenoma. And the goal of the surgery is to remove that parathyroid adenoma and return your calcium levels to normal. Now, the preparatory work for parathyroid surgery involves getting parathyroid imaging. In our situation, what we use is a CAT scan and ultrasound to identify that offensive parathyroid before we actually take you to the operating room. So we know exactly which parathyroid we're going to remove. So before the surgery, you're going to have a preoperative clearance approximately a week or so before the surgery. At that time, you'll have a chest x-ray if you need one, and an EKG and blood work drawn. The internist will also go over to ensure that you're medically fit for the procedure. 1 week before the procedure, you also want to avoid any blood thinners. We give you an entire list of such drugs, including various supplements and vitamins that can cause bleeding during the surgery or after the surgery. You want to avoid that so we don't develop a hemorrhage or hematoma after the surgery. The night before the surgery, nothing to eat or drink after midnight. The day of the surgery, you can take your blood pressure pills with a sip of water only. Please do not eat or drink after midnight. Now, the day of the surgery, you'll be coming into the hospital. You'll be visited by the preoperative nurse who will go over to make sure that the EKG, chest x-ray, the internist report are all in the chart and everything is okay for your surgery. I should mention that 3 days before the surgery, you'll also undergo COVID-19 testing, which includes both the PCR as well, or molecular study, as well as the antibodies. Please be aware that all of us in the operating room suite are also undergoing the same testing to ensure your safety during the procedure. The day of the surgery, then, you'll be seen by the preoperative nurse. You'll also be seen by the anesthesiologist, who will discuss the anesthesia that you're going to undergo. It's general anesthesia. If you have any questions regarding the anesthesia, please address them to the anesthesiologist. If you've had previous anesthesia and have had nausea afterwards, please discuss that with the anesthesiologist, because they could administer certain drugs to prevent that situation. The operating room nurse will also come in, further discuss and prepare you for the surgery itself. You'll then be escorted into the operating room and general anesthesia will be administered. During the surgery, we'll remove that offensive parathyroid gland, and we will send it at that time to the pathology lab to confirm that it's a parathyroid adenoma. We will also do blood work to ensure that your parathormone levels, which control the calcium level, has returned to half of the elevated level, to ensure that you'll have recovery from your condition. The surgery itself should take about half an hour. But the pathology and the lab work takes another half hour. So the usual span of the surgery is about an hour. Depending on your medical condition and the surgery that you undergo, you may be discharged home the same day, you may stay overnight. We would encourage you to stay off of work for 3 to 4 days afterwards. Certainly the outer extent is about a week, but more patients return within 3 to 4 days to their usual activities. Now, after the surgery, you can expect very little pain in this area. That is not usually a factor. We do want you to turn your head side to side and down. Please do not raise your head like this, because you will stretch the incision. After a week, I'll inspect the incision, and if everything is okay, you can take a shower after that point. Also, you'll be applying a special cream on the incision to make it fade. Any incision can be damaged by the sunlight, and therefore we advise you that if you're going to the beach or if you're doing outdoor sports or gardening where you're exposed to sunlight for a year, to please apply sunblock over that area. That's what you can expect before, during, and after your parathyroid surgery. If you have any questions, please do not hesitate to call us at 212-472-8882. You may also visit us on our website at nyheadandnecksurgery.com. That's nyheadandnecksurgery.com. Thank you very much, and have a good day.